My name is Dr. Elishia Mckay. I work here at the Women's Health Institute, and I am a subspecialist in the field of urogynecology. I work to treat both in the clinical and surgical space for pelvic floor disorders. Pelvic floor disorders, urinary, structural-wise, are very common. Okay, so as I said, they do increase after menopause. However, things like childbirth also influence it, and just being a woman and having female anatomy will certainly predispose you to these issues. They're quite common. 1 in every 3 to 4 women will experience a pelvic floor disorder at some point throughout the course of their life. I always like to tell patients these are super common. You may have a family member who has had it, but has not really been able to talk to you about it. And that is something that I am passionate and my colleagues are passionate about, is destigmatizing these issues so that we get the care to women that is needed and deserved. I do try to offer a range of clinical therapies for these disorders. So I will typically start by describing the conservative interventions. These are things that we might be able to do, change our lifestyle, change our diet, change our habits, that can improve urinary or pelvic organ prolapse type symptoms. I also offer medical therapies. There are medications that are now out on the market that do help and assist us in managing particularly bladder issues. I also offer a wide range of vaginal as well as minimally invasive surgical interventions. This would include things like looking at it from a urinary standpoint, bladder Botox, sacral neuromodulation, percutaneous tibial nerve stimulation. I also offer vaginal surgery and approaches to prolapse, which would include things like hysterectomies, apical suspensions, as well as robotic surgeries, which would include even attaching a vaginal mesh or a mesh abdominally used on the vagina to lift and hold up any prolapse that did occur. I'm actually originally from New York City. I grew up here in Queens, and I then proceeded to do my undergrad as well as my medical training at the University of Miami in sunny Florida before coming on back home, and I was so happy to do so. I did my intern year here at Maimonides, and then I continued my residency at Yale up in Connecticut. I then returned to New York and did my fellowship, which was 3 years, at Montefiore. Maimonides has always stood out. Maimonides is truly unique, and that is everything from the patients on up. We live in one of the most diverse areas that I've ever lived in, and I so appreciate that. I appreciate that I am in a given day speaking 5 or 6 languages with the assistance of our language line and able to provide comprehensive patient-based care to so many different people from all different backgrounds. That's something that's always been important to me.